I'm going to treat the nasolabial folds now with some Restylane. I like to bend the needle tip just slightly. Here we go. We're going to go in a deep dermal, almost subcutaneous plane. And I try to inject retrograde, putting the needle in where the last bit of Restylane wet, just to try to give her a little more comfort. How uncomfortable was that?
It was okay.
Okay. And then we'll work on our oral commissure here a little bit. A little vertical injection and then a little X. How are you feeling?
Okay.
Good? Okay. So no bruising. Okay, we'll do the same here. And I watch while I'm injecting. I know I want to use 1 cc of Restylane for her. So I used half on the right side. So that's a little bit. How you doing? No major bruising yet. Okay, we'll do a little X here at the oral commissure. See how that looks. Pretty good. Sometimes we see the left side a little bit worse than the right from the sun exposure you get from driving. Occasionally you need a little bit more on the left side. And that's a nice improvement. Put just a little depot right here, and we're done. All right, on this patient, we're going to be treating these deep nasolabial folds and marionette lines. Because of the depth and the heaviness of her cheeks, I've decided to use Radiesse. In this syringe, I have mixed 0.4 cc's of 1% lidocaine. And you can also see that I've bent the needle a little just to help me get the right angle for insertion. So now we're going to start. And we're going to go in a deeper plane here. And as I'm injecting, I'm withdrawing the needle, and then I stop injecting right before I pull out of the skin. And because this has numbing in it, I like to treat every area a little bit, and then go back to the areas that have become numb. In a retrograde dissection. Turn your head towards me a little bit. Good. So that's going to get every area starting to numb. Now we're going to come horizontally here to work on these heavy marionette lines. How you doing? Is this very uncomfortable? Do a little X here on the oral commissure. And maybe one vertically here as well. It always helps to smooth out any irregularities. Disperse the product. You're already starting to see an improvement there. Now we've already numbed this side with a little bit of filler. We're going to work a little bit more now on the oral commissure and the marionette lines. Again, this is radius with some 1% lidocaine mixed with it. And I'm going to treat horizontally here, doing a retrograde injection. I want most of the product to be medial. That's why I'm coming at this angle. And I stop injecting before pulling out of the skin. A little fanning technique here. These are heavy nasolabial folds and difficult to elevate, but my best chance of doing this is with radius. Try a little depot in here. It's always nice to open your mouth when you feel inside. Make sure that it's not lumpy inside. Sometimes the patient will tell you they can feel it with their tongue. In that case, just press it out. Is that hurt, Amy? Okay. Much better. Now we've already placed some radius here. It should be getting numb. I'm going to layer this with a little purlane, just to soften these folds a little bit more, and then we'll move on to her lower lids. Now with radius, we always tell patients it'll feel a little bit firm for the next few days, and then it'll soften. I can go a little more superficial with the purlane. I'm bending the needle just a little bit. And we have radius in deep. We're going to layer this with a little purlane. It also has lidocaine. And just sort of topping off those folds. And we'll see if we can put a little bit more purlane in here, a little more superficial, bring those oral commissures up some. You can feel a little area here that I've missed. Hopefully that will bring it up. You can push it into where you want it. It's a helpful technique. All right, on this patient, we're going to be treating the nasolabial folds, the marionette line and the oral commissure, the pre-jowl region. And for this, we're going to be using Restylane. I like to angle the needle a little bit when I use Restylane. All right. She's been using topical numbing for about 25 to 30 minutes. This has lidocaine in it, so the more I inject, the less it will hurt. When we inject the nasolabial fold, we come in at an angle, and we come in lateral to medial, so that the bulk of the injection is medial to the fold, and I inject less as I'm coming out with a retrograde injection, so that I don't increase the fullness of the lateral fold. How you feeling? Okay? I like to go in an area that I've already numbed, fan a little bit here in the nasolalar crease. It always helps to feel what you've injected, to feel areas you've missed, and to also massage the area to flatten out any lumpiness. The injection plane is deep dermal or immediately subcutaneous. With the corner of the mouth, we're going to make an X. Again, a retrograde dissection. Injection, a retrograde injection. I make an X, and then I like to put a little depot right at the base, which gives her a little bit more lift. And then again, massage to flatten that out. Occasionally, open your mouth. It's a little lumpy in that area, and a little intraoral massage will help. Now that I've injected this area and it's numbing, I'll go back to it and inject right in the fold, again in a retrograde injection manner. And here, to treat the marionette lines, we'll go lateral to medial, and then massage. Doing okay? Mm-hmm. To do the pre-jowl area, it's a depression just in front of the jowl. I'm going to inject pre-periosteal here in order to get things started. And then I like to layer this in different planes in the subcutaneous tissue, and then mold it into position. Sometimes the jowl actually extends in the submandibular region, so it helps to do a little injection in that area to fill that in. Okay, you can see the difference here, how this is improved. Corner of the mouth is improved, the marionette area, and the pre-jowl region. And that was 1 cc of Restylane. Other fillers that can be used for this are Juvederm, Perlane, Juvederm Ultra or Ultra Plus, Radiesse, Belotero. We've used the needle on this side. On this side, we're going to show you how to use the cannula. This is a 25 gauge needle that we're using to make a hole in the tissue. Sometimes the challenge is finding that hole again, so it's fun. Just wait for it to bleed a little bit. And this is a 27 gauge cannula. Now I don't have to aspirate here because I know I'm not going to be intravascular. I can also change my direction. Okay. Change the direction. Into the jowl area here. Okay, take that away. On this patient, we're going to be treating the nasolabial folds. We're going to use Perlane in the deep areas, and then we're going to layer Restylane on top. This has lidocaine in it, so we're going to inject a little bit and then follow our track so that it hurts less. I'm injecting in a retrograde fashion. I'm advancing the needle and then injecting as I withdraw the needle. And then massaging is very important when you do fillers. Make sure that you haven't missed any spots, and also to smooth the filler out. It's also nice to do a little bit of horizontal injection of this area. Again, retrograde is nice because the volume of the filler will go medial, and I'm injecting less as I come out. And already you can see the difference. How's that feeling?
Better.
Better
than the previous without it.
Yeah.
It's a big difference.
This is the first time she's had the filler with lidocaine. We used to do a dental block for her, just so it hurt less. But now, I don't think she needs one.
No.
Okay, we're going to do the oral commissure now. We'll make an X in this direction and in this direction. And that'll lift the oral commissure up. You can also go vertically here. And then we'll do the marionette lines. This is a difficult area to treat, especially this triangle here. I've heard it called the black hole of fillers because it takes so much to fill the area. Now I mostly do linear threading, but occasionally it's nice to do a little depot. Open your mouth for me. And you can always press this to where you want it to go. It helps prevent lumping afterwards. Okay, close your mouth. How's this feeling now that it's numb?
I can't believe the difference, to be
Yeah.
honest.
I might feel this a little bit.
Not like before.
Yeah, much more tolerable.
Mm-hmm. The difference is dramatic.
Yeah, I know. I get it in my lips, and I've also noticed a big difference. Sometimes it's also nice to fill the mental crease with a little filler. Again, this is purling. Just makes it not look so severe. Alright, so this side is finished. So you can see we've already treated this side. Now we're going to focus on this side. This was 1 syringe of purling. When I inject, I like to bevel the needle just a bit, because it just helps me with my angle. So again, we're going to start here. I don't like to put my first injection right in the nasolalar crease because that hurts a little bit more. I like to get it a little more numb before I inject there. And again, we're going deep dermal, almost subcutaneous with this purling. I'm going to do the X at the oral commissure. And then fill the marionette lines. Going horizontally here. And then vertically. Occasionally, if it's depressed in an area, you can even push it into the area that you want it to go into. It's very moldable at this stage. Now that she's getting numb, I'm going to put a little bit more in here. Probably hurt a little bit.
Not like before.
A little more dental blocks for you here. Go a little bit horizontally here again. Retrograde injection, advance the needle, and inject as it's being withdrawn. A little more mental crease. See if we can get our oral commissures up any more with filler. If not, we can always put a little bit of Botox in the depressor anguli oris. I like to feel also and see if there's any areas that I've missed. I can push this into position. I can massage it so that there aren't any bumps. Okay. And that's after 2 syringes of Perlane. Okay, so here we're going to treat the nasolabial folds and that marionette lines. This is Perlane. So with this we're going to treat deeply. This has lidocaine in it. And first we go a little deeper. Hurts a little bit in the nasolabial fold area here as we get closer to the nose. What we like to do is treat an area and then go back to it, and then it's a little more numb. I'm going very deeply with this to try to get her a little bit numb, because I'm going to follow this with Bellatero, which I can use to treat more superficially. She has a little acne eruption here. It's not a fever blister. I think we're safe to be using fillers in this region. If she had any more of an active infection or fever blisters, I would not treat her. We always want to be careful in this region where the angular artery is. And again, we're going to do a little volume here. Start the numbing medicine going. So that was 1 cc of Perlane. All right, this is Bellatero that we're using now. We're going to treat her lower lids. I'm injecting deeply, and I'm going to come more superficial. Massage it into place. I've already placed a little bit of Perlane here to start getting a little numbing in that region. I can also mix lidocaine into the Bellatero if I want. So now I'm going to come a little more superficial, and this area should be pretty numb. Okay, look up for me. Good. A little more in the tear trough region. You can even do some fine lines here with the Bellatero. Okay, there for a second. Looks really good, Christy. Okay. Look up for me.
Yours is talking back.
Yeah. Look up again. Mine's deeper. Okay, take that away.
Mm-hmm.
Look up for me. That's nice. Look up again. God, you're gonna be so happy with this.
Mm-hmm.
Look up again. Oh, that looks good. Look up again.
Much, but I don't think it lasted long.
Okay, stop. I'm going to use Radiesse for these deep nasolabial folds. Put a little bit in the marionette pre-jowl region. On this side, we're going to use the needle that comes with it. I have mixed lidocaine. Let this area get a little numb. I'm injecting deep in the superficial subcutaneous plane. Radius will get a little firm in the next couple days, and then it will soften. This can be injected pre-periosteal or subcutaneous, but not intradermal. Like the hyaluronic acids, we do massage this into place. Should not be used in the lips, but we can put a little bit in the oral commissure if we want to. we're going to layer a little Restylane more superficially here over the radius. There isn't any reason you can't mix products. Is it getting pretty numb there? You feel any of that?
I did feel a little bit.
Turn the corner of her mouth up nicely with that. Do a little on your chin. It's going to hurt. Okay, so we've treated with radius and Restylane here, corners of the mouth with Restylane, a little bit of radius, the chin with Restylane, pre-jowl with Restylane and radius.
Start?
All right, we're going to do the nasolabial folds now. This is Restylane Lift. I like to inject the nasolabial folds and actually fan out a little bit into the upper lip. So I go along the fold here, and then I fan out a little bit. Now you do have to be careful with the depth of your injection here, because you don't want to hit the angular artery. So I'm making sure I'm not too deep, always watching for blanching of the area. Looks nice. Occasionally I'll bring this injection up around the nasal alar crease if I need to. And that just softens that area a little bit too. Same thing here. I'm going to inject a little bit along the nasolabial fold and then fan it out medially. One of the danger areas, you need to be very careful here.